Good afternoon, everyone. My name's Catherine from the Belfast Reading Centre in Queen's University, and I'm a senior grader there. And I've had the privilege of being involved in establishing diabetic eye screening in Dodoma, Tanzania. So Dodoma is the capital of Tanzania, right in the centre of the country on the edge of the Southern Highlands. And although it's the capital, it has a population of about 400,000, which is about a tenth of the population of the former capital, Dar es Salaam. So consequently, a lot of the advanced medical treatments and a lot of the ophthalmologists are based in Dar es Salaam. So quite often people have to travel there for treatment. So just an overview of diabetes in Tanzania. There were just under 1 million adult cases in 2020, which equates to about 3.7% of the population. And like a lot of African countries, there's a shortage of ophthalmologists and a sort of shortage of endocrinologists. So for example, there were only 5 pediatric endocrinologists and 5 dietitians involved in diabetes care in the entire country in 2015. The IDF estimates that the number of adults with diabetes in the IDF Africa region will reach around 47 million by 2045. So diabetic retinopathy, or DR, is the commonest complication of diabetes mellitus, and globally over 4 million people have vision loss due to DR and 1 million are blind. So diabetes damages the blood vessels, forming bulges in the vessels called microaneurysms at the early stage, and then leakage of blood and fluid from the vessels occurs, and eventually new vessels begin to grow, causing major damage. So the eyes are one of really the only place where you can look, get an overview of your circulation by looking into the retina. This DR can be treated by laser or anti-VEGF injections, but the key thing really is that there are no changes in the vision until the condition is very advanced. So quite often people can present at the very late stage when it's almost too late to do anything for them. And that's why screening services are so important. The macula is a small area in the center of the retina responsible for most of the fine detail and color vision. And leakage of fluid at the macula particularly impacts the vision. So any changes there are recorded separately. And any exudate, which is the white bright specks there in the image, are referred for treatment and for more frequent monitoring. So how the project got started, Queen's signed a memorandum of understanding with Dodoma University and Benjamin and Kappa Hospital back in 2018. We had some training visits back and forth, and we provided support online, but they still didn't have a retinal camera. So in 2021, we received an extra grant of €10,000 to help establish screening there, predominantly to buy the camera. So handheld cameras have come on leaps and bounds in the last 4 or 5 years. Really, 5 years ago, you wouldn't really have considered doing diabetic screening with a handheld camera because the image quality was so poor. But in the last few years, they've improved massively, and they're now at the level where the standard of image quality is so good that they're good for screening, and they don't even require dilating drops, which is a huge advantage. So the camera arrived in Dodoma in April this year. And a couple of weeks later, I went out to train the screeners to use the camera, get the program established and start some screening clinics. So we sorted out what staff members were going to be doing the screening. We finalized the screening form, did a couple of days of training with the camera and some practice. And then we went out and had at three different hospitals. We had clinics and screened over 50 patients during our first week. So how have things changed? Previously, patients attended their diabetes clinic. Their eyes weren't examined at all. They only would have attended ophthalmology if they were having problems with their vision, which, as I've already said, is really too late. And no ophthalmology department in any hospital in Dodoma had a fundus camera. So now patients are screened when they attend their diabetes clinic. Dr. Joshua and Benjamin Kappa grades the images, and patients then are called back with results and asked to attend ophthalmology if they need treatment. Unfortunately, though, at the current time, if they need laser or anti-VEGF injections, they have to be referred to KCMC in Kilimanjaro or Mumbili in Dar es Salaam, which are both about 500 kilometers away. although there are talks at the minute about getting anti-VEGF injections started in Dodoma, which would be a huge advantage. So they're hoping to get that started in the next couple of months. So results, we had our aim at the start of the project was to have 100 patients screened by the end of October this year. So we've actually managed to screen 175 patients across 3 different hospitals. The preliminary results on patients from one hospital, so one set, just over 50% had no retinopathy, 25% had mild retinopathy, 12% moderate or pre-proliferative, 2% proliferative, and only 7% of the images were ungradable in both eyes. And that was usually due to pathology such as cataract. 22% had changes in the macula. So with all these projects, there are always challenges. One of the things we had hoped to get further on at this stage was having more remote clinics across the Dodoma region. But that has been a bit of a challenge just in terms of staff time to go out to these remote areas, and also just funding for that as well. So that's been slow to get up and running, and we're hopefully going to progress that in the near future. But 3 hospitals so far have been having clinics. They were to visit us in January at the start of this year for some training and to learn how to use our handheld camera. But Omicron sabotaged that visit. And then they were to be here this week for training, but visa problems with the UK visa system so backlogged that they couldn't make it. So hopefully it's been rescheduled for January next year. Successes, we're up and running in 3 hospitals, 175 patients have had their eyes screened who wouldn't have never had their eyes checked. And multiple patients have been referred for treatment, have had treatment, and are starting to see improvements in their vision. So a big thank you to Esther Ireland, Optimed, and the whole team in Tanzania. Thank you very much.